Dravet syndrome, as many people know, is a developmental and epileptic encephalopathy, which means the children have significant developmental disability of varying degrees and also have very difficult to treat epilepsy. There are a lot of developmental and epileptic encephalopathies that are like that, but Dravet syndrome is unique, and the reason why we wanted to have this consensus is because of the two unique features of Dravet syndrome. One is that most of the children prior to their first seizure have normal growth and development. And so we are making the diagnosis of this very difficult to treat epilepsy in the setting of a child who had normal growth and development and likely experienced just one or two prolonged febrile seizures. The other thing that makes Dravet syndrome unique is that the children have up to an 18 to 20% chance of dying, and their death is related to sudden unexpected death in epilepsy or SUDEP, or status epilepticus, or drowning or injury that, again, is usually seizure-related. Most other children with DEEs who die do so of progression of their underlying disease. Most of the time, it's recurrent aspiration pneumonia. And so just to set the scene, we are sitting down and making the diagnosis of this very severe epilepsy syndrome in a child who, to their parent, looks perfectly healthy. They have normal growth and development. They've just had, again, could be just a single febrile seizure. And we're going to explain to the family that the child is going to have developmental plateau and regression, is not going to live independently, is going to have recurrent provoked and unprovoked seizures. Even with medications, the child is going to have recurrent life-threatening status epilepticus. And so these are very challenging, emotionally charged appointments, much more so than with other DEs. The other reason to do this is there are standard recommendations for treatment of Dravet syndrome, for follow-up in Dravet syndrome, and so we want to be consistent and also have standard recommendations for how we sit down with families and make the diagnosis of Dravet syndrome. And so we thought the consensus approach was the best way.